Welcome, and thank you for joining us to learn more about the School of Nursing's Doctor of Nursing Practice, Postmaster of Science in Nursing program. Throughout this session, we'll refer to it simply as the DNP program. Today, I'll be walking you through the key details of our 5-semester DNP program and what makes it a unique and valuable doctoral program. We'll cover the philosophy of the DNP and a brief history of our program, our goals and outcomes with this degree, the structure and curriculum, as well as the application requirements, tuition, and deadlines. We want to highlight that one of the most important and unique parts of our program is the Scholarly Project. So we'll take a few moments to talk about what it involves and the types of topics our students typically explore. We hope this session gives you many reasons to reach out to us, to learn more, or even to start the application process. We have an admissions team that is happy to answer your questions and guide you through the entire process. What makes UT Austin's DNP program truly unique is it's tied to a world-renowned research institution. Our students have access to leading experts, not just in nursing, but also in public health, social work, pharmacy, engineering, geosciences, and communication. DNP students draw from these diverse disciplines in the work they do every day. They also have opportunities to attend and present at conferences, gaining valuable experiences and exposures in their field, as well as expanding their contributions to the field of nursing. The 45-hour curriculum for the DNP program is based on the essentials of doctoral education for advanced practice developed by the American Association of Colleges of Nursing, and it addresses all the required competencies. Courses cover a range of topics including philosophy and scientific methods in nursing science, policy, management of health services organizations, health economics, epidemiology, and health sciences information systems. The overall goal of the DNP program is for students to develop a professional nursing identity rooted in leadership, ethics, and lifelong learning. Throughout the program, students will integrate nursing science and ethics and interdisciplinary knowledge to enhance person-centered care. They will implement evidence-based practices, policies, and innovative strategies to improve health outcomes. Students will also advance nursing scholarship through ethical and evidence-based research. DNP students lead quality, safety, and technology-driven initiatives to enhance healthcare in the modern era, and they collaborate with interprofessional teams to optimize care and outcomes. One other feature that makes our DNP post-MSN program unique is that it's delivered in a hybrid format. Students commit to 9 credit hours per semester for 5 semesters and meet on campus once a month for 2 consecutive days on a Friday and Saturday. These in-person intensives include lectures, student presentations, and group discussions. They allow the students to connect with each other and the instructors and help solidify what they learn in the online portion, which is how the rest of the program is delivered asynchronously. This convenient hybrid format provides students the opportunity to maintain full-time employment while completing their program and is flexible with their schedules. Now let's discuss the structure of the program. Semester 1 consists of the students' required prerequisites, including understanding the DNP leadership role, introduction to research, and evaluation methods, and how one translates evidence to nursing practice. Semesters 2 through 5 consist of supporting courses and scholarly project practicum courses. Students are required to complete 1,000 practicum hours. Students who completed supervised practice hours during their MSN can apply up to 500 of those hours towards the required total. They can also count up to 500 hours through National Nursing Certifications by submitting a portfolio. That said, at least 500 practice hours must be completed during the DNP program itself. Students also have the option to add a focus in nursing education by taking 3 additional courses. Throughout the program, students develop practice expertise and focus on clinical research area, which culminates in the DNP Scholarly Project. Here is a look at the courses by semester. Next, we'll cover the curriculum. The DNP program curriculum is designed to provide the highest level of professional nursing education for nurses via a terminal degree in nursing practice excellence. The curriculum advances the education and leadership competencies of nurses and prepares graduates for increasingly complex practice and clinical leadership roles. The DNP program has 3 focus areas. Number 1, the development of an individualized area of clinical leadership specialization. Number 2 is dissemination of scholarly work via publications and presentations. And the third is electives in nursing education and teaching. DNP prepared nurses are also nurse educators. This program's clinical teaching electives are designed to meet the growing demand for highly prepared clinical faculty for schools of nursing. In the clinical specialization seminars, students identify and develop their practice expertise in a focused clinical area, culminating in the scholarly project, which they present in the last semester of their program. This research-based healthcare project might involve creating a new program or improving a healthcare process, and it can be submitted for publication or presented at a professional conference. Students are paired with a faculty mentor, as well as experts from the healthcare industry to give them valuable guidance and real-world insight throughout the project. People often ask about the DNP's impact or return on investment. Some students want to enhance their leadership skills, some may want to improve patient outcomes, and some may want to contribute to healthcare innovation. The way we look at the impact is simply to ask our alums. For example, one recent DNP graduate said, "My experience at UT Austin prepared me well to become a better educator for my own nursing students. Seeing courses through the eyes of a student opened a new perspective on my students and the struggles they face." Another grad said, "The in-person hybrid format was essential as an adult learner, especially after years of completing military training and education entirely online, which often felt limiting. The university's proximity to major military medical institutions also aligned with my goal of focusing my project on military-specific issues while gaining experience in the civilian sector." And the third graduate said, "UT's DNP program definitely taught me how to be a nurse leader, because it was all about changing the status quo and of trying to create something that didn't exist. And so going against the grain really helps create change, and that is what nursing is all about, creating that change to improve healthcare outcomes." Now, let's take a look at the eligibility requirements and how to apply. let's specifically talk about the statement of purpose. Applicants should discuss their goals as a doctoral prepared nurse in a 2-page double-spaced statement. Instructions are provided on the application for admissions and on the post-MSN DNP webpage. Due to the hybrid modality, this program is not approved for international admissions. All students applying for formal admission to the DNP program need to complete the online application. You'll find it on the School of Nursing post-DNP webpage or the UT Austin Graduate School admissions page. Here are a few important things to keep in mind as you complete your application. The application is only open from September 1st through June 1st. We recommend submitting that application at least 2 weeks before the June 1st deadline. Be sure to select the next available fall start date. Enter all colleges and universities you've attended along with the exact dates of attendance. About 72 hours after you submit your application, you'll receive an email with instructions on how to pay the application fee and upload your supporting documents through the My Status page. Now, on to tuition. The cost for the DNP program includes 9 credit hours at $6,000 per semester for 5 consecutive semesters. Total DNP program cost for 45 credit hours is $30,000. This flat fee covers tuition and fees for access to the university's standard student services such as advising, career services, gyms, libraries, and research databases. The price is the same for all students, regardless of residency status. Please note, the cost per semester can vary depending on how many MSN clinical practice hours you bring in and how many portfolio hours are approved. DNP students have several funding options available to help pay for their education, including federal financial aid, private education loans, and/or veterans benefits. The DNP page on the School of Nursing website has this and more information about tuition and funding. There are several ways to connect with us. Our fantastic admissions team is here to support you through every step of the process and answer any questions you may have. Don't hesitate to reach out to anyone on our team. We're here to make sure you have everything you need. And be sure to check out our YouTube channel for more video resources. We look forward to connecting with you soon.